Good afternoon. I'm Jim Inkster, your moderator, and Governor John Bel Edwards is in the house, and he's ready to take your calls at 877-217-5757. This is the second Ask the Governor show for Governor John Bel Edwards, and he has a guest. The Secretary of the state's largest agency, Dr. Rebekah is also with us, so if you have any questions pertaining to health care, this is a pertinent time to ask those. We do ask that you make your questions brief, that there only be one question, and not any statements accompanying the questions, because we have many people we'd like to get to along the way who, of course, are listening statewide to the Ask the Governor show with Governor John Bel Edwards. Now, Governor Edwards, you have made it clear that health care is a major issue in this state. It's certainly the largest budget item, and there are some issues that remain to be solved. What's going on?
Well, Jim, thank you for the opportunity to be back today, the second in our series of Ask the Governor, and I want to thank the listeners for tuning in as well. Because it's the largest area of the state budget, it also offers the most opportunity for savings and efficiencies and some things that we can do to just simply make sense for the state of Louisiana. In this case, what I want to talk about today primarily is the decision that I made to expand the Medicaid program, whereby we're simply bringing our federal tax dollars home to put them to work for our working poor so that our hospitals get reimbursed, our employers benefit from having a healthier, more productive workforce, and in the process, we're going to save the state $184 million in the first year. And with this budget deficit that we inherited, which while we whittled it down to $600 million for the year starting July 1st, $600 million is still a huge number, and that would be $184 million worse without the Medicaid expansion. So I'm excited about it. Enrollment starts next month, and then the expansion itself kicks in full on July the 1st. And I want to make sure that people have the opportunity to ask questions and get the information that they need. We do have a website that people can access information on. It's healthy.la.gov, and they can go there. There'll also be some phone numbers that they can call to get additional information. But this is not simply about expanding the Medicaid program so that more people have health insurance coverage, although that's very important. This is ultimately about improving the health of the people of Louisiana and achieving better health outcomes, and that is the primary mission that I have given Dr. Gee as the Secretary of the Department of Health and Hospitals, and I'm very happy that she's with me today, and she can actually offer some of her comments as well.
Sure, Governor. So our new program, Healthy Louisiana, will ensure that most people in the state of Louisiana will have health insurance. Health insurance is not the end of our battle. We also have to have people be healthier, and that means eating healthier, exercising, eating that great Louisiana food, but making sure they're also doing those things to improve their health. But this is a huge step along that way, and we're so excited to see the benefits to the health of our population, as well as to relieve that anxiety that so many families around the state have. As a practicing physician, I've seen it so many times when people can't afford their insurance and worry about their health. So at least we can get that worry off the table, get people focused on getting healthier.
877-217-5757. Let's go first to John in Shreveport. Good afternoon, John. You're on with Governor John Bel Edwards and Secretary of Health, Dr. Rebekah Gee.
Thank you, Jim. My question is brief, but Governor, you had mentioned during the campaign that moving older adults into managed care was your absolute goal, and I'm curious if that's still your position and when that might happen, especially since that's where most older adults say they want to live. And I know there was a bill yesterday, House Bill 790, that addressed that.
Yeah, well, John, thank you for the question. Comprehensive long-term managed care is a goal that I have. I will tell you that we're not quite ready to go there yet, because I don't believe that the stakeholders are singing out of the same songbook on that. For example, we need to make absolutely sure that when we interpose that insurance company between the state and the provider, that we're not unnecessarily consuming dollars that could go towards services for the elderly folks in this case who would need those. And we need to make sure that we're focusing on quality of the care. And so we've got some work to do. I have been in discussions both with folks in the nursing home industry, but also with managed care organizations, trying to get them to sit down and bridge the divide. I do know that a number of states have gone to long-term managed care. I think it is less than a majority of the states out there. And so we have to make sure that the savings would be real, that the quality would be there, and quite frankly, we're not there yet, but it does remain a goal of mine that we can get there.
Leslie in Homa. Good afternoon, Leslie. You're on Ask the Governor.
Hi, I'm a single mother in Houma, Louisiana, and this last year, I went on to your government ACA website and put in my financial information, and which was $14,000 of income, and I was told that my monthly premium was going to be $360 a month with a $14,000 copay. Not copay. And, what I would have to meet, which was the exact same amount as my income. And this did not include my child. My child was going to be included in free health care. So I'm just curious, how is it that anybody expects someone like me, who is not on food stamps and any other kind of government assistance, and has to pay $566 for my contribution to the system, is supposed to make it?
Leslie, I believe you're talking about the federal website and the Affordable Care Act, and that's not something we run at the state level. And the question indicated that you believe that was a state website. And I can't answer those questions because I'm not intimately familiar with that. I can tell you that for folks in your situation, where the $14,000 annual income may knock you out of Medicaid eligibility, the Medicaid expansion, the executive order I signed on January the 12th, actually makes you eligible for Medicaid coverage going forward. And so that is a big problem that we tried to fix, so that the hole between those who are currently eligible for Medicaid and those who actually have access to insurance through the market or through private providers, that we can fill that hole. And so I think if you will go to healthy.la.gov, you can find some information on the state website that I think will be a benefit for you and your family.
You're listening to Ask the Governor on the Louisiana Radio Network. Governor John Bel Edwards is here, along with Secretary of Health and Hospitals Dr. Rebekah Gee. Your number is 877-217-5757, and we'll be back after this short pause. This is Jim Inkster with producer Michelle Southern, and Governor John Bel Edwards is the host. It's Ask the Governor, and his guest is Dr. Rebekah Gee, the Secretary of the Department of Health and Hospitals. Your number is 877-217-5757. Once again, we implore you to be brief when you do get on the line. Please be patient. If you get a busy signal, keep trying, and you're likely to get in. We've got several lines, but as you can imagine, many people want to talk to the governor, and this is the first time in more than a decade a governor of Louisiana has hosted a show of this kind, and this is number 2 of many Ask the Governor shows. Governor John Bel Edwards now 4 months and a week into his first term in office, and Rebekah Gee, the Secretary of Health, has been busy with many issues, much regarding the budget, but also what's the latest pertaining to the Zika virus?
So, Jim, last time we were on the show, we talked about the fact that there were no local cases of transmission, meaning mosquitoes in Louisiana did not have the Zika virus and were spreading it. That is still the case. All the cases that we've had in Louisiana were people who traveled outside into Zika-infected areas and brought it back with them. The CDC, however, still does recommend all pregnant women, people planning pregnancy, not to travel to areas where Zika virus transmission is ongoing. Those are parts of Africa, Southeast Asia, the Pacific Islands, the Caribbean, Central and South America. And of course, this summer we may have, at this point we don't, but you want to protect yourself from mosquito bites because mosquitoes have other illnesses that they carry. And so wear protective clothing, make sure to spray, and particularly with Zika, make sure that you don't have standing water in your yard. So we're recommending once a week when you go out and take out your garbage, even a bottle cap, these Aedes mosquitoes can breed in that. So make sure to take it out. Any pans you have under your pots outside, don't use those. Turn them upside down over the summer, and just don't have standing water around your home. Try to reduce your chance of spreading these mosquitoes.
Johnny in Monroe. Good afternoon, Johnny. You're on Ask the Governor. All right, Johnny, tell you what, we're going to try to get you to a better place, and we'll go to Sam in New Orleans. Sam, good afternoon. You're on Ask the Governor.
Good afternoon, Governor. Thank you for taking my call, and thank you for actually doing the show. I really do appreciate it, honestly. First, I want to start with the medical marijuana bill and just say thank you for signing that into law. even though I do not think it goes far enough. The second thing I want to speak on is I heard you just recently come out about the recreational marijuana and that you were against it. I want to know why you're against it. I want to know, have you done the studies on different states like Colorado and see that they're making millions and actually making billions, and we're actually running a deficit? And how do you feel about drinking and driving? Because we know.
All right. One question, please. Go ahead.
Now, Sam, I'm a lawyer, and your question would draw an objection. That's a compound question. But I will be signing the medical marijuana bill tomorrow. I do believe that that's the right approach. The state shouldn't stand between a doctor and its patients when the doctors believe that that is the best available means to alleviating some pain and some suffering and to make someone better. And I think the bill is carefully crafted to make sure we don't have creep, so that we have an unlimited number of medical conditions for which it can be prescribed or recommended. I don't support recreational marijuana usage. I will tell you, I'm happy to allow Colorado and Washington State to do that if that's what they want. We can maybe one day be in a position to study what happens in those states with respect to what they're doing. But I have no comfort level with that right now, and just don't support that approach.
David in Lafayette. Good afternoon, David. You're on the air with Governor John Bel Edwards and Secretary of Health Rebekah Gee.
Good afternoon. I get a question, I guess, concerning the budget as to what, I know John Kennedy had proposed a lot of things that would help the budget. What from John Kennedy are you applying?
Well, first of all, David, thank you for the question. John Kennedy proposes a number of things, some of which might help, some of which actually wouldn't. But one of the things that we have done, in fact, this started actually before I became governor, is we actually have started a comprehensive review of contracts that we have issued at all the state agencies to find those where we have state general fund dollars that can be saved either through canceling or not renewing or in fact maybe even reducing the amount we're paying on those contracts. I know that is something that the treasurer has often stated as a way that we can save money. We're actually doing that. We've renegotiated, in fact, the contracts, what we pay to our managed care organizations with the Medicaid program. We're now paying the lowest amount that CMS would approve. Previously, they were paid at the 50th percentile range of an actuarial range. We're going to the 7th percentile. We're renegotiating the contracts with the private partners and our charity safety net hospital system so that we can achieve savings there. Those are some of the biggest contracts in the state. So those are things that we're doing. Those are things that we would have done whether or not Kennedy suggested them. But I will tell you that that's an area where I think that there's agreement.
Joe in Opelousas. Good afternoon, Joe. You're on the air
How
with
you guys doing?
Governor Edwards.
I was calling to ask you, Governor, what is the principal difference and the reason why Governor Jindal refused to expand Medicaid and you decided on very rapidly to expand it? Can you?
Yeah, well, first of all, it wasn't a rapid decision to expand it. I've been studying this issue for several years in the legislature, and in fact, for 3 consecutive years, I offered legislation trying to force the Medicaid expansion because I thought it was the right thing to do for our state. Simply, rather than sending our money to Washington where it gets reallocated to the 30 states that accepted the Medicaid expansion, I thought it would be better to bring it home, put it to work for the working poor here in Louisiana, because they need access to health care. They need health care coverage. Our providers need reimbursement for the care that they're providing, and our employers need a more productive, healthier workforce. And in the process, we're saving $184 million. We're going to make a big impact as it relates to mental illness. I believe we can save money in our Department of Corrections as well. So for me, it was the easiest big decision that I'm going to make. But Joe, I would never characterize it as a decision that was made hastily or rapidly. This was something that I had studied for a number of years.
877-217-5757 is your number. Kimberly in New Orleans, you're on with Governor Edwards and Secretary Gee. Hi, Kimberly.
Hi, I was just wondering if the governor could address the phenomena that when you come in with marketplace insurance, the office visit at many places is prohibitive. So my normal doctor under regular insurance, $150, come in with marketplace. It was a deposit of $250 and they'll bill me for the rest. I just find that completely unfair.
Yeah, Kimberly, you're talking, I'm assuming, about the Affordable Care Act and what's available to you on the federal marketplace. That is not something that I am familiar with in any depth, but it's my understanding there's not supposed to be a copay for primary care or preventative services under the Affordable Care Act. And so I'm at a total loss to explain or to answer the question that you just asked. But if you've got a question, or if there's a question out there as it relates to health care that we are providing at the state level, we're certainly more than willing and ready to answer those questions.
Again, and that's what the Medicaid expansion addresses, is for folks who really, frankly, can't afford those payments, who are within the income levels for Medicaid, there will not be co-payments for primary care. So the Medicaid expansion solves that problem.
877-217-5757 is your number. And let's go to Greg in Church Point, who's been waiting for a little while. Greg, good afternoon. You're on the air with the governor.
Hello. My question is, the police in Acadia Parish out here don't seem to enforce the noise problems with music, thumping loud music, and motorcycles with no mufflers, and 18-wheelers with no mufflers, just running straight pipes.
All right. Now, I'm not sure that's an issue that the governor is going to be dealing with, but what do you think, Governor Edwards?
Well, Greg, I appreciate your patience for waiting to ask that question. Obviously, I would hope that you would communicate with your chief of police, with your sheriff, maybe with your police juror, in order to make sure that they know that you have got a concern and complaint about that, and can register that with them, and I would hope that they would take action. But other than that, I'm not sure what to tell you, Greg.
You know what it's like to have faced noise issues. You faced it in the military, I would imagine.
Well, I did, and I will tell you, I've been in public service now for a number of years, and as a state representative, I'm accustomed to getting all sorts of questions about things like that. And I appreciate Greg for asking the question. It is part of our job, not just to answer questions, but to redirect people to where they should be going with respect to their concerns or their questions.
877-217-5757 is your number. Michelle Southern's the producer. The governor of Louisiana, John Bel Edwards, is with us, as is the Secretary of the Department of Health, Dr. Rebekah Gee, who dealt specifically with Medicaid prior to becoming secretary. So with the expansion, how many people are we talking about will have new access to health care in Louisiana?
So over 300,000. We think in the first year, 375,000 working families will benefit from expansion.
370,000. And that's in a state with about 4.6 million people, so we're talking about a good portion of the population. Christina in Lafayette. Good afternoon, Christina. You're on the air with the governor and Secretary Gee.
Thank you. I am a medical professional, and I've noticed that in the hospital setting, we'll have non-citizens come in, illegal immigrants actually, and they're not billed for services. How will the hospitals, physicians, ancillary services be compensated for the services they provide and the care that these people get if they don't?
All right.
So, Christina, under current law, undocumented immigrants who are pregnant are covered because of their unborn child through the Medicaid program, but they are not covered for health services. They're not eligible for Medicaid expansion. And so, unfortunately, under EMTALA law, where a emergency room is required to at least assess and stabilize an individual who comes in, that will not change. So it's a problem that's ongoing, but one that Medicaid expansion doesn't solve.
But Medicaid expansion does solve part of the larger problem of uncompensated care, because there will be more compensation flowing to hospitals for the care that they do provide for the uninsured, but the Medicaid expansion will not be available for illegal or undocumented aliens.
Tim in Bossier City. Tim, you're on the air.
Hi,
Hi, good afternoon. I am a retired state employee, and I have two adult children who are currently state employees. And I'm just curious what the governor's plan is. I know that they're losing state employees left and right due to, number one, the lack of merit raises that are due each year, and number two, the rise in the insurance premiums that the state employees are having to continually absorb.
All right.
Well, first of all, my mother too is a retired state employee, and the problem as it relates to state employees is not unlike most of the problems we're trying to solve right now in the state of Louisiana. We simply have to stabilize our budget situation, which is easier said than done. As you may remember, we inherited a $2 billion shortfall for the year starting July 1st in terms of state general fund. Through a lot of hard work and a lot of cooperation with the legislature, we've whittled that down to $600 million for next year. Still an awfully big number for the state of Louisiana. But clearly my plan is to stabilize the state, put us on an upward trajectory so that over the coming years we can strategically reinvest, and that includes in the public workers.
We're halfway through this hour of Ask the Governor, so you've got another half hour to get in if you would like. 877-217-5757. Thank you for listening. Our host is the Governor of Louisiana, John Bel Edwards, and he is also here with Secretary of the Department of Health and Hospitals, Dr. Rebekah Gee. We'll be back after this brief pause on the Louisiana Radio Network. This is Jim Inkster. Thank you for being with us for Ask the Governor. Governor John Bel Edwards is here. Your number is 877-217-5757, toll free wherever you are in our state or beyond. If you get a busy signal, please be patient. Secretary of Department of Health and Hospitals Rebekah Gee, Dr. Gee, is with us as well. We go back to the phone lines with Kyle in Baton Rouge. Good afternoon, Kyle. You're on the air.
Hi, Governor. My question is about what Louisiana is going to do about the opiate problem that is, going through our country right now, and just in general, mental wellness as well, that deals with this.
Well, Kyle, thank you for the question. I will tell you that at my very first National Governors Association conference at the end of January, this was a topic of concern to the governors all over the country. And we talked about a number of things, and I'm going to ask Dr. Gee to mention a few of them, but I can tell you that we absolutely have to make sure that we make Narcan readily available to first responders, so that they can administer that without a prescription, without delay, because we know that it works. But there are obviously some other things that we have to do. And one of the things that I know that they're studying at the federal level is really restricting the ability of physicians to prescribe too many painkillers at the same time. And so that's something that we're working on as well. But Dr. Gee, I know you've got some more information on this.
Sure. So, Kyle, this is a sad epidemic that affects so many of us. And over the past 10 years, we've seen 10 times the number of folks die from opiate overdose than we had before. And their babies been born with opiate overdoses. And it's a huge problem in our state. So, of course, as the governor mentioned, making sure that our first responders have access to Narcan. Having Narcan available without a prescription is an important new development this legislative session. Well, we need to study what's going on in other states. Massachusetts has some interesting proposals out there, things about restricting the number of pills that physicians can prescribe, and just being careful, being knowledgeable, understanding that if you have a pain, you may want to get a prescription for too many, because there's a lot of addiction. Some people have that addiction gene, and just what seems like a benign or not dangerous prescription for one person might lead to an addiction for another person. So we need to have continued conversations about it. And thanks for asking, Kyle.
Charles in Mandeville. Good afternoon, Charles. You're on Ask the Governor. Charles? Okay, I tell you what, Charles, you hold tight. I don't know what's going on with your line, but let's go to Perry and Lafayette. Perry, good afternoon.
When are we going to review the business and tax credits that are available presently in the state? I know you looked at them in the budget squeeze, but when are we going to review those tax credits and possibly look at what could be cut?
Well, Perry, thank you for that question. You may not know this, but last year we actually shaved a number of the credits and rebates from 100 cents on the dollar, I think it was to 72 cents on the dollar. in a temporary way. We have to look, because we have a long-term structural budget deficit. We need long-term structural fixes, and that certainly includes business tax credits. When you look at the credits and the refunds, it was only in the month of April, and of course the month ends at the end of June. I'm sorry, the fiscal year ends at the end of June. It was in the month of April that business taxes actually got into the black. We were paying out more than we were receiving up until that point. So this is a big problem. It's something that we have to fix. We have a task force that is meeting under the direction of Dr. Jim Richardson, an economist at LSU, and Secretary Kimberly Robinson, the Secretary of the Department of Revenue. They're going to report by September the 1st a plan to achieve long-term structural tax reform, and I believe that curbing business tax credits will be part of that, especially the refundability part. It may be okay to have a tax credit that you can apply to your tax liability, but when you have a tax credit that is worth more than your tax liability right now, in many cases when it is a refundable tax credit, the state is actually writing a check to the business. And so this isn't raising taxes, this is cutting spending. And it's something that we have to do to get our structure in order in terms of our taxes in Louisiana.
Chuck calling from New Orleans. Chuck, good afternoon. You are on the air.
Yes, Governor. It's widely known that Louisiana is the most incarcerated state in the United States. Per capita, we have more people in jail than anywhere else in the world, including North Korea, Brazil, Afghanistan, you name it. Why is this not an emergency?
Well, as you know, it's a point that I ran on. I don't believe the people in Louisiana are more criminal or more sinister by nature than those anywhere else, and so we shouldn't have the highest incarceration rate, and we don't have the safest streets as a result of it. So, and the recidivism rate isn't as low as it should be. So taking all of those things into consideration, we know that we're paying more than we should have to incarcerate that many people, and so we ought to put ourselves on a different path. We are going to do that in terms of a comprehensive set of legislative initiatives in the 2017 session that looks at sentencing reform, overall criminal justice reform, with an eye towards reducing the incarceration rate going forward by using proven strategies that have already been adopted in other southern conservative states like Texas and Georgia and South Carolina. We're going to do that in Louisiana, and we're going to make it work for us. It's just simply the right thing to do, both because we can't afford to keep incarcerating more people, and also because it's simply the wrong thing to do to incarcerate more folks than the rest of the country. So I look forward to doing that in 2017. And you should know that already over the last few years, the Department of Corrections has reduced our incarceration population by about 4,000 people.
All right. Magboul in New Orleans, good afternoon. You're on with Secretary Gee and with Governor John Bel Edwards.
Good afternoon, Governor. How are you, sir?
I'm doing fine, thank you.
What's your question?
Sir, my question is that I'm a licensed professional engineer from Texas and Tennessee, and I won't have any problem getting a license in 30 other states except for Louisiana. They have made it personal. Louisiana Professional Engineering Board has made it personal. Your predecessor, Mr. Jindal, I applied to him to get the reciprocity, and he told me go ahead and get your local legislator to put together a bill.
Yeah, I will tell you, I don't have an answer for you, but I would hope that you will stay on the line and talk to my assistant, and we will try to get an answer to you on that. And I apologize, I'm just not conversing in that issue right now.
And if you call right after the show, I think we have lost you on the line, Magboul, but call the same number after the show. We'll take your name and number, and the governor's office, I'm sure, will be in touch. 877-217-5757. Mike in New Orleans. Mike, good afternoon.
Yeah, good evening. I was wondering if the state had any plans to paint the Chalmette Bridge again.
I don't know whether we have plans to paint the Chalmette Bridge, but I can find out through the Department of Transportation whether that is a plan, and if so, whether we have money allocated for it or not. But Mike, I would ask you to try to talk to Mitch, and we will get the information so that we can call you back with that answer.
Thank you, sir. Willie in Ruston. Good afternoon, Willie. You're on the air with the governor.
Governor, can you explain to the people of Louisiana how taxes are raised not by virtue of John Bell Edwards waving a magic wand and raising taxes, but the procedure it goes through in the legislature?
Well, sure. And Willie, the way that works is not only does the legislature have to act through the legislative process with a bill, when you raise a tax because of the rules we have in Louisiana in the Constitution, it actually takes a supermajority or a two-thirds vote, both in the House and the Senate, to raise taxes. Now, it is true that I have proposed some revenue-raising measures as well as some expenditure reductions, both the traditional expenditures through House Bill 1, the appropriations bill, but also through tax expenditures that we reduce our tax credits, our tax rebates, exemptions, and those sorts of things. But through a balanced approach to addressing this budget deficit, I have proposed both revenue-raising measures, which require a two-thirds vote of the legislature, and expenditure reductions. But that is the way that works, and of course it requires a lot of consensus, a lot of hard work to get two-thirds of the legislature to agree upon a tax increase.
877-217-5757 is your number. We still have some time to go with Governor John Bell Edwards and Secretary of Health Dr. Rebekah Gee. And if you'd like to get in, there should be an opportunity in the next 16 minutes or so. So we'll be back after this brief pause on the Louisiana Radio Network. Good afternoon. This is Ask the Governor. Governor John Bell Edwards is in the house for another segment, 877-217-5757. The governor is joined today by Secretary of Health, Dr. Rebekah Gee. Marion in New Orleans. Good afternoon, Marion. You're on the air.
Hi. I don't have a medical-related question, but Governor, in Governor Jindal's first term, he proposed a 10% cut in state-owned vehicles for the Veterans Department, and it seems to have never gone anywhere. To me, it's an expense that could easily be cut back, not 10%, but 20 or even 50%. And other employees in private industry use their own vehicles, and they're given tax value.
All right.
Marion, thank you for the question. I believe that in Governor Jindal's term, and I don't know this for a fact, but I believe there were reductions in vehicles. And in fact, at one time, we were actually renting cars for state employees when they had to travel to different parts of the state. And there were many agencies in the state that concluded they were spending more money renting cars than if they had held on to the cars that they owned. Now, already in the current fiscal year, we have cut almost completely based upon my actions and my recommendations to the legislature over $230 million. There will be additional cuts next year, but I trusted the Division of Administration, capably led by Jay Darden as the commissioner, and the folks who run the different agencies to take those budget reductions and work with them in ways that produce the most efficient way to deliver services for the state of Louisiana. And if they can do that by eliminating vehicles, if they've got too many and they can save money, then I'm certain that they will do that.
Marcy in New Orleans. Good afternoon, Marcy. You're on Ask the Governor.
Hi, Governor, Secretary Gee. Question for you about the special session. Governor, I know that you want to have it right after the regular session. Some members of the legislature say we should wait maybe until September. When do you see that it will really happen, and why do you think it's so important to do it right after the regular session?
Well, we have to do it right after the regular session because the next fiscal year starts July 1st. And the Constitution obligates me to have a balanced budget, not a 6-month budget, as some people would suggest is what we should do, is get to September and just see what happens. But starting July 1st, we have to have a balanced budget. And any cuts that we have to make based upon the revenue estimating conference estimate, in terms of the dollars we're going to have to spend next year, those cuts are going to go into place July 1st. And so I believe it's important to have a second special session. So come July 1st, and actually a few days before that, higher education and every state agency in the state of Louisiana understands what their budget is going to be for next year and can make the appropriate adjustments. At the current time, we are $600 million short. I don't believe it is possible to pass a balanced budget that reasonably and responsibly funds critical priorities such as higher education, health care, the TOPS program, housing inmates, you name it. And in fact, I think this was proven to be the case last week when the legislature did what they did with the budget in the House and sent it over to the Senate. We have too many needs, and if we're going to fully fund TOPS, if we're going to not cut higher education for the 8th straight year in terms of general fund support, if we're not going to cut K through 12 by $50 million, if we're going to fund our private partners who run our safety net hospitals, if we're going to fund waivers, which are critically important to families so that they can care for their loved ones in their homes, we've got to do that after a second special session. June is the time to do it.
Sarah in New Orleans. Good afternoon, Sarah.
Hi, Governor. I am calling regarding the student loan debt crisis that's in our country. My husband and I are both professionals in our late 20s that graduated college with a considerable amount of student loan debt. And while I know this is mostly on a federal level, they're federal loans, I was wondering if there's anything on a state policy level, either through tax cuts or otherwise, that could assist people like me in paying these loans back, and what your position on that would be.
Sarah, I don't envision anything in terms of relief through the tax code to help you pay your loans back. I do recognize this is a big problem. It's a big problem because nationwide, you've seen a trend over the last number of years away from state general fund support for higher education, and the funding component is very heavy on tuition and fees. Well, we have students who have to borrow money to pay the tuition and fees, and the more they have to borrow, the more their debt is when they get out. So my plan isn't going to help you to pay yours, but I want to stabilize our funding for higher education, stop increasing tuition and fees, and over time, as we can, strategically reinvest more state general fund support so that we're not visiting such a large burden of debt on recent graduates. We have people graduating from universities now in Louisiana and elsewhere with something that approximates a mortgage payment on a house, but it's student loan debt, and that is obviously not in the best interest of our state, of this nation, or certainly of the individuals who are suffering under this debt. But we can get it under control here, but we've got to start reinvesting in higher education in terms of state general fund support and stop these annual double-digit tuition increases like we've had over the last 8 years.
Marcia in New Orleans. Good afternoon, Marcia. You're on the air.
Hi. Good afternoon. Two quick things. Governor Edwards, I just wanted to thank you from the bottom of my heart for bringing the Medicaid expansion to Louisiana for the specific reasons that you highlighted earlier, and also because it is the morally correct thing to do for people. And then I was also a very strong supporter of the Stelly plan. I was thrilled to be able to be paying Stelly taxes. I was incredibly disappointed when it was rescinded, and if there is any way you can buck the trend and bring that back, I am one voter that would support you, along with my husband, 100% in paying those taxes.
Well, Marcia, thank you very much. And the Medicaid expansion, clearly the right thing to do. And by the way, it's a conservative notion that you ought to get the benefit of the taxes that you're paying. And for a long time, we weren't doing that in Louisiana. But with respect to the Stelly plan, I will tell you, we will be better off if we simply got ourselves back to where we were before Stelly was ever implemented. Because you hear quite often that we repealed the Stelly plan. That is not true. We repealed all of the revenue-enhancing parts of Stelly, and we left on the books all the parts of Stelly that reduced the revenue that was coming into the state of Louisiana. For example, excess itemized deductions were at 57.5% before Stelly. Today, they're at 100%. So if we just got back to where we were before Stelly on that, that's about $120 million a year. Guess what? That is big step in terms of funding our government and erasing this $600 million shortfall.
Shannon and Zachary. Good afternoon, Shannon.
Hi, Governor Edwards. This is Shannon Woodside. Thank you so much for taking my call. I was wondering, my daughter attends a pediatric day center for medically fragile children, and I'm just wondering if the budget is cut and those funds are removed, what are we supposed to do with our babies, and what are our other options going to be?
Well, Shannon, thank you for the question, and I will tell you that as far as what the budget is going to look like come July 1st, it is premature to know whether and how much there will be cuts to the pediatric day care program. But obviously, we believe it is an important program. That program in Louisiana, however, has grown more than any other state in the nation over the last couple of years. And so we do have to make sure that we are controlling the growth and that we are making sure that there are really quality in terms of the care that's being provided. But I want to ask Dr. Gee to step in and offer her insight on this program as well.
So Shannon, thanks for bringing up this important point. So in the budget that we had recommended, we recommended reforms of PDHC. There are children, and my staff has now completed a review at every facility across the state. There are some children who don't need to have PDHC services. Our plan includes transitioning those children into the services and the appropriate facilities and or schools that they could be in. But there are children that really do need PDHCs, and we want those children to be able to access PDHCs. And that's one of the reasons why we need a special session. We frankly right now don't have the money. It's not just PDHCs, it's 4 of the 6 waiver programs, waivers that provide food and supportive services for thousands of families with disabled children that are on the cut list. So we really are at a crisis point in terms of the DHH budget. And as you know personally, PDHC is one of those very important services that we need to fund.
We have about 90 seconds to go, so this will be our final caller, Carol in New Orleans. Good afternoon, Carol.
Hi. Good afternoon, Governor. I'm so glad we finally got a Democrat in the governor's house again. And I know it's going to take a while to turn things around. But my question is, these corporate-run charter schools like Success Academy, some of the charter schools are fine, the ones that were good schools before the hurricane, but these corporate-run charter schools with all this autonomy, there are mice running around, some of them, and these kids are going to school in deplorable conditions. What can the state do to make certain that these kids are getting a balanced education in the
Well, Carol, first of all, we do have a lot of really good charter schools, and some of them are marginal and some of them are not so good at all. I don't believe in mixing a profit motive with public education, and so I like the not-for-profit model much better than the for-profit model. I don't think that a profit motive should ever interfere with the decision-making when it comes to how we can best educate our kids.
And this will be the conclusion of today's show. We thank the governor and Secretary Gee for coming and answering all questions today. And the governor will be back in 4 weeks on June 15th, Wednesday, June 15th. So mark your calendars for that. And if we didn't get to you today, we will certainly endeavor to do so. And if you call in the next few moments and have a question, we will certainly pass it along to Governor John Bel Edwards. Thanks for listening, and we'll be back in a few weeks. Stay tuned.